and then we can make a start. Okay, I think we'll make a start, and hopefully others, if they're planning to join, will join us as well. So afternoon, everybody, and welcome to question time. Apologies if I cough or my voice goes. I've been talking all morning, so yeah, my voice isn't holding out particularly well. So as always, I think some updates from myself, some key areas that I want to communicate to, really, and then please an opportunity for any questions. I think Chloe's just popped in, either use the chat, but again in this forum as well, always keen for people to raise their hand and have a bit of interaction as opposed to just hearing from myself. So, and just as a bit of housekeeping, if you're not talking, if you can go on mute, just so that we don't have any background, I'd appreciate that. Thank you. So just some updates. I'll start with COVID, but then we can obviously move through. There's other things going on in the world despite COVID still being with us. So a couple of key points really just to pick up from that. So at the moment, as it stands, we still remain in a level 4 national incident managing COVID. I'm not hearing anything. I've got some regional and national calls this afternoon. So whether there's any thoughts at the moment around stepping that down, people will be aware after the first wave, it stepped down into a level 3 incident. So still oversight, etc., but not as nationally driven as it has been. But as it stands today, we're still in that level 4 incident. Really encouraging to say prevalence is on the decline, and that's both community prevalence, but also admissions within hospitals as well. The one thing I'd say around, although positive that we're seeing it coming down, it seems to be coming down a lot slower than previous waves and other variants that have been thrown at us. So as I say, encouraging to see it coming down, but maybe not as quickly as it peaked. So as an example, Shrewsbury and Telford today still have around 40 patients with COVID in hospitals, which, if we think back to previous waves, that was sort of, high sort of end for previous waves. So certainly still with us, but an encouraging picture. I'm pleased to say at Robert Jones, and have done for the last couple of weeks, we have no patients certainly that are COVID positive within the hospital. The other area to pick up, staff absence, again improving. Today around 5%. That's all sickness, and I think COVID related is around 1%, just over 1%. So again, if we think back to a few weeks ago, that's encouraging and in a much better position. I will still say that we have some areas that's challenging. So that percentage is the overarching trust percentage. That's not to say certain areas and departments have higher absence, so therefore does impact from an operational delivery. So positive, but not to move away from the fact that there are some areas that are still struggling. To touch on vaccination, certainly is a condition of deployment, also known as VCOD. People will hear it called that term, and you'll be aware we've spoke about it in previous forums, including this one. People will be aware the legislation's been paused, so it's not gone away yet about mandating vaccination within healthcare for healthcare staff, but it is paused pending the outcome of the public consultation that I think ended on the 16th. So there was opportunities for everybody really to feed into that consultation. At the moment, we just await the outcome. So as soon as we have any more information around whether it's been scrapped or whether it will be adopted in its entirety as it was first set out to, or whether there'll be any changes made to that, obviously we'll communicate that out. I suppose more importantly for me off the back of that, we're still encouraging staff to take up the offer of vaccination. I don't want that to go away. Obviously it's personal choice, but it's ensuring people have the right support, are really fully aware really of the options that are available and any information to help them make that informed choice. So we continue to do that and support managers and our staff in that decision making. So I don't want us to get sidetracked with the legislation, but the importance really of vaccination and enabling our staff to take up that offer. I think next in relation to IPC from a COVID perspective, and yeah, when I prepared sort of this yesterday and then had to rethink some of this off the back of some of the government announcements, but I would still say, as I was going to say, although the world is changing, there's still clear guidance that exists within healthcare environments around IPC off the back of the measures that were put in place due to COVID. I generally, if people have got questions to ask me following the government's announcement to end restrictions that we would have heard yesterday, I don't yet know what that means for healthcare. As they've reduced restrictions, as we all know, they maintain them within hospitals and other healthcare areas. So I generally don't know. As I say, I've got calls this afternoon whether any of that will be raised, or if they can at least let us know if there's any work in planning. That will certainly help us. The one area that they have looked at, certainly for trusts such as ours, elective hospitals, that there's some more relaxed guidance that's come out, and some of that's around distancing, testing, pre-op testing, and also standard cleaning. And I know Sarah and the team are currently working through what that may mean, or what that might open up for the organisation, or enable us to navigate our way through some of the guidance that's currently in place. So that is a change, but that was issued pre the government's announcements yesterday. So yeah, how that will work going forward, it may change again. So important that we make sure we communicate out as and when we hear of these changes, so you all know really what the guidance is. I think just moving away from COVID, and some of you may or not be aware. I'd have thought you would be aware, but we had in the summer last year an MRSA outbreak in one of our wards. People will be aware. I remember having conversations in forums such as this around things that they found that we needed to look at across the whole organisation, such as storage, faulty equipment. I think there was rusty equipment, etc., and put a real big focus, really, a lot of energy in improvement work. Unfortunately, and sadly to say, we had a revisit last week, beginning of last week, end of the week before, and received the letter on Friday with their findings. Have to say, disappointing. So they went to multiple areas and found issues that really should have been dealt with and sustained following the work that we'd done back in the summer. There are There is work in progress where some of them things that they identified are being resolved, and some of it was easy. I'll give an example: a fridge that should have been condemned that hadn't and was still in use. That's easy to fix. We just condemn the fridge. But there's other areas that need a bit more thought through and a bit more work. I think my plea to you all, wherever you work, whether that be in a clinical area or not, around, you know, cleanliness, clutter, storage, faulty equipment, you know, we all as a trust need to take ownership of the areas that we work in, to ensure they're nice areas for the staff to work in, but ultimately safe for patients to have care delivered in. There's also a separate piece of work that we'll be looking at is around the governance and oversight, and how did we not see some of the issues that those who came in from a regulator perspective saw. So there's a lot of work. It's a priority amongst others within the organisation at the moment, but we have to get a grip, put the things that we found that aren't right, but sustain it and move forward with good governance and good oversight for the future, so we don't find ourselves in the same position as we found ourselves in today. So a lot of work. There may be some asks of you as individuals within your areas, so please do respond and escalate any concerns that you've got as well to your manager. You know, if you're finding stuff or you're trying to put things right and are struggling to do that. So really important that this is a focus for the safety of our patients. Really is important. The other area, just while I'm talking around that, is around training. IPC training as a perfect example. And again, if you know that you're due training and either can't access it or are becoming out of date, etc., again, please do speak to your manager or somebody within the team to be able to support you with that. Really important. Staff need to be equipped with the knowledge and skills to be able to do their job and to make sure, as I say, we're not in this position again. I think I'll keep going with updates and then be able to open up, because I can see things flashing up in the chat. So I hope we've got questions coming in. Other area I wanted to touch on was around elective recovery, and the national sort of elective recovery plan has now been published, and we touched on this in manager's briefing last week. I won't go into all the detail that we did at that, but really important that people are aware, really, with the ambition within the plan. So this is a national plan to be able to really make a dent and some inroads into the volumes of patients on our waiting list, which we all know. We're all well versed in the impact of COVID on electives. Really needs to be a focus of the organisation, and again, some good conversations, planning, etc. But it's ambitious. The plan is ambitious to meet levels of, if I say 130% of activity that we were doing really in 1920, so before COVID hit, and how we do that. So lots of work and planning in progress around that. Other thing just to note, that the guidance for any of you who are interested in it or have already had a look at it, it's English guidance. So again, makes it difficult for us as an organisation. As we all know, we treat Welsh patients as well, so there's different guidance as well that's soon due to land around that. But yeah, certainly what's come through so far is for English only patients. I'm going to move on now to something totally different, and flooding. So, and for those of you who live in Shropshire, which I'm sure most staff do, to be aware, we put some comms out yesterday that certainly Shropshire's declared Again, a critical incident off the back of the flooding, which I think this is the third year running that we've seen significant impact due to flooding. I'm sat at home today surrounded by water, hence I'm not in the trust today. You know, perks of living on the River Severn. Luckily my house is on stilts, but it's I feel like if I look out my window to the right, it looks like I'm in a boat. So just to put some context into it, but I know some staff are having challenges with road closures, etc. So again, comms yesterday did put out around some of the information around that, so people can look to planning their journeys, etc. Lots of work in the system around supporting vulnerable, especially vulnerable patients who are at home, who rely on home care, district nursing support, etc., to ensure that we're able, as best as the system can, to ensure that care is delivered. So our local authority colleagues, certainly I met with them this morning around some of this. There's a lot of work and support out there. There's boats going out today to certain areas. So yeah, a lot of support. And then the other thing really just from me, again, good news really is around the launch of our new trust intranet. That's due to launch on the 1st of March. So thank you to the comms team, project team, and those that have been involved so far. I think the main purpose of this is to have something that's user friendly. There's a wealth of information that we hold as an organisation that's not always that accessible. Good news with the new intranet, you don't need a VPN, you can access it via phones, via an app, etc. So really today, just to say, keep an eye out, because there'll be more communications around how you access that. So as an example, with your NHS Net email address. So again, asking managers to support their teams to ensure that they can access. So there'll be far more information coming out through comms, but from what I've seen so far of what's been pulled together during the softer launch of it, it's really good, really good. And you know, if I think the key important thing is communication. It's not the only way, but it's one way that we can make sure key information or documents, etc., are available, readily available for staff. So yeah, please do have a look, and yeah, look out for the comms that are going to come out with more information around it. I'm going to pause because my voice really is going. Chloe, I don't know if you're with me. If there's anything coming through in the chat.
We've had one question from Nina White. So she's asking, what position are we taking with patients and IPC? Some are not wearing masks, but we have clinically vulnerable staff.
Yeah, I'm not hearing, Nina. So first I've heard that we're still having problems with patients and mask wearing. At the moment, we're still asking the polite questions. Obviously, there's those that are exempt, which again, I know at the front desk we developed, didn't we, the lanyards, etc., so that they're not asked multiple times if they are exempt. But for me, we haven't changed the stance at the moment because the guidance hasn't changed. The expectation is all staff and patients are to wear masks in healthcare settings. So I would always say we challenge politely and professionally, and we raise awareness of it. But yeah, I wasn't aware that we were still having difficulties. But if you want to expand, Nina, if it's generic or if it's just occasionally it's happening.
Sorry, yeah, it's at our outreach clinic, so I guess they're coming into an environment which isn't kind of utterly imbibed with giving a cultural message. So that's been our issue. It's our Shrewsbury outreach clinic, and it's only occasional, but it can be quite confrontational. And obviously it's our HCAs that are providing our front door function, if you like. So yeah.
the thing is as well, isn't it, with all the changes, I don't know whether masks will still be part of healthcare as it has been. It's been really clear all along, but it's with the government's announcements yesterday, I don't know how we can be as strict in healthcare as we have been. It's going to be incredibly challenging to manage. So I'm hoping nationally there'll be guidance or some changes to the current ways of working. Is it much to ask in a healthcare environment? I don't necessarily think it is. But as I say, I think it needs to be adopted as a national health service as opposed to individual organisations. I hope they don't leave us to decide that, because I think that's where it will become even more challenging.
If they do, Stacey, then I'm sure you'll reach the conclusion anyway, but it would be great to then just think internally about how we support clinically vulnerable staff. And it might just be about the way that we manage their caseload or whatever, but it would be good to think ahead to that.
Yeah, thanks, Nina. I think I just saw a hand pop up.
Yeah, it was Mr. Kelly.
Hi, Stacey. I hope I'm giving you a little heads up on this question. Unfortunately, you asked, I hope we get national guidance, but for this particular question, there isn't national guidance, or if it is going to come out, it's going to be very slow to come out, and lots of ICSs are making their own decision. And it's all about the new rules of engagement for patients coming into hospital through a green pathway.
Yeah.
So lots of people are just doing basically no need to isolate. You're asked about your COVID symptoms. You have a lateral flow on the day of surgery, and you go ahead unless you're in a special high risk group, and that would be basically most of our patients, to be honest. So you have to be double or triple E vaxxed, and you have to have a negative lateral flow. Do you know what the plans are for our hospital and our local ICS?
Yeah, good question, Cormac. I touched on it briefly at the beginning. So that guidance has come in. So there's I think there's three strands to it in elective, as you say, for the green pathways, that being the distancing, pre-op testing and isolation and cleanliness standards. So I know Sarah and the team, Cormac, are working through that at the moment with a proposal. I think we need to move to it. It'll be my honest opinion, with the safety measures. And I think what you circulated to me earlier on is quite helpful, actually, the flow chart that's been developed elsewhere. It's just ensuring that we've got the right information on patients around vaccination status, etc. But if I think back to the government announcements as well last night and what testing capacity is going to be available, again, I think we have to adopt that approach. I mentioned at the beginning, interestingly, will that change again? So I think there's something around, I absolutely get Sarah and the team working through what we've currently got, but I think we need to keep our eyes open to whether there'll be further changes as well, that are going to be made off the back of the government announcements. So yeah, so it's basically in response to your question, Cormac. It has been picked up in the trust, and it is at an ICS level as well. But notwithstanding, it's very much around elective, the green pathway. So it has been picked.
It would certainly help us, especially with short notice cancellations, which
Definitely.
is a big issue. So it would hugely increase our capacity, but also maximize what we've got on our lists, because we can call people in at relatively short notice.
Yeah. But also, but also as well, Cormac, in relation to the expectation that patients isolate for 3 days, that's a lot to ask for us to ask of individuals. And you could say they're coming in for surgery, etc. It was right, it was the right thing to do at the time with COVID. Is it still the right thing to do now? I'd question that.
And are they compliant? They're probably compliant. But anyway.
Yeah.
That's great. Thanks, Stacey. Thanks for that.
Thanks, Cormac. Chloe?
We've had another question in the chat from Prasanth. So on the theme of the government guidance changing around COVID, so he's asking, with the scrapping of lateral flow testing, do we still need to test daily if in close contact with a COVID positive person?
Yeah, again, we're sort of preempting, aren't we? Typical. Nice of Boris to announce it just before I do a question time. So again, I suppose we need time we need something that will, what we always find with the government, there'll be an announcement and then there's a bit of a gap and then there's further guidance that will follow through. So I think at the moment, off the back of it, let's just hold fire and wait for what comes through. At the moment, I didn't see his announcement, but I read it back last night, and there is reference in there around isolation if you're positive, etc., and different dates, I think, as things change. As of today, and until we say otherwise, we adopt and continue to adopt what we're currently doing, and we'll, as I say, we'll communicate out any changes as clearly as we're able to. So obviously everybody's clear on what the ask is. But it's a good question to ask. I just, yeah, unfortunately don't feel at the moment we've got enough information to be able to answer it.
And Victoria Sugden's popped in the chat about the 100 saplings that are being planted around the path of positivity. So I don't know if Victoria wants to come on and say a few more words about that.
Hi. Yeah, just to say this is part of celebrating our 100 years on site, but also as part of sustainability. And who doesn't like to plant trees? So it's a lovely thing to do. And Anna Turner, the Lord Lieutenant, is going to come and join us. Harry Turner is going to join us, and Stacey, I think you're joining us as well, to see those trees in the ground. But it's all part of trying to make the path of positivity improved and keep making that a nice space for staff and patients to use, really. Benches coming and some other seating and picnic tables as well. So that's the plan.
Brilliant, thanks Victoria. It's good to share some of the good stuff, isn't it? Some of the positive areas and work that's going on in the trust. So thank you. Chloe, back to you.
There's nothing
Anything else?
Nothing else in the chat at the moment. I was wondering if you wanted to touch on flexible working, because we put some comms out yesterday around the policy updating and the video that SLG filmed with medical illustration.
Yeah, thanks Chloe. I always rely on you to prompt me, help with my full head. So yeah, and I did see that it had gone out in the comms yesterday, so really pleased to see. So this is really off the back of a commitment as a senior team to support staff working flexibly at Robert Jones. We all know that if we can provide flexible working opportunities for staff, it's great to recruit and to retain our staff. So a real commitment from us, which, as I say, the video outlines from members of the senior team, exactly that. There's been a revision to the policy, which dovetails really into that commitment. There's more work to do. So a policy and pledges and commitment is one bit of it. It's how we enact it to enable people to work flexibly, and I think that's a bigger piece of work that we're going to pick up as an organisation to support managers. I will look still as a nurse. I remember back to being a ward manager and having multiple different asks from staff around flexible working, and I understand and acknowledge as a manager it can be incredibly difficult to accommodate, and that's where I think the work needs to take place now around how we support managers to be able to think differently so that we can implement flexible working to help retain staff. And things have moved on. I think if I think of ward, we focus on ward routine and maybe not different ways of working. So I think more information to come off the back of it, but great to be able to launch the concept and certainly the policy for staff to familiarise themselves with. Thanks, Chloe.
And unless anyone's got any final questions or comments, I think that's it.
Anybody want to be brave and pop their hand up? I hope it really, I generally mean it, that people, before, Prasanth, you've saved me.
Can you hear me?
Yeah, we can hear you, thank you.
Sorry, I don't know whether you can hear me.
Yep, I can hear you.
Sorry, I don't know whether you can hear me, but I just this is a comment, it's not a question. I think the teams has made a vast improvement in the way how we communicate within the trust. And it's really made quite a lot of difference, particularly to a person like me who work in shift, and I was on night on call at the hospital, and I'm in Telford, which is 40 miles away. So I could still come home and listen to these talks. Do you think we can continue this for a long term? I think this has really been an extremely good way of communication.
Yeah, I think you're spot on, Prasanth. I think it's a really good point. And I think that's some of, isn't it, grasping some of the ways of working, or some of the different, what we adopted during COVID. There's bits of it we don't want to lose. And I'd agree. I think, you know, I value face to face as well. And I think there needs to be that approach whereby we do reintroduce some things back to face. I'm keen to do that as well. But I don't want to lose sight of actually how this has enabled us to communicate more widely across the organisation. So I think teams will last. Teams will stay with us. If I think back to system working or some of the regional work and national work that I'm involved in, I don't want to be going back to the days where I'm travelling on a train for hours on end, you know, for a meeting, whereby this gives us both efficiencies but also access to other people far easier. So yeah, we won't be losing teams. I think there's work to reintroduce face to face at the same time, but some of the work that we do on teams definitely will be keeping. It's a really good point.
Thank you.
Anybody else?
I just wanted to say, sorry, this is just, I thought, a good opportunity to jump on. We're doing some sort of comms / celebration next Friday for Overseas NHS Workers Day. So it's just a nice chance for anyone who wants to get involved to send a picture and say kind of what you do in the hospital and what it's like to work at RJAH. Yeah, so I think there has been comms about it on the Facebook group and an email, but if you do want to get involved, give me or Chloe or the comms inbox an email. But yeah, it's just going to be a nice sort of little celebration of all the different staff that we have at the hospital.
Brilliant. Thanks, Lydia. Good way in there. I like that. Just get in there and get your plea across. Thank you. Okay, folks, I'll take it. I can't see any hands. Please do use this opportunity, either in the chat box or be brave enough to pop your hand up. Normally you find that one person's thinking of it, there'll be others that are as well. And I do really want people to think this is a safe space, you know, to ask any questions. There's no daft questions, there really isn't. So please do. Those that you might want to go away and have a little think, but you know, as I say, really keen to hear from staff, as opposed to just my own voice that is steadily going. So okay, I think I'll close it there. Thank you all, truly thank you for everything that you continue to do. It's still tough. I think it's going to remain tough. Let's look after each other, support each other. But yeah, big thank you from me. Take care.